Okay, well, a warm welcome to Katie, Kelly, and Christine. We've invited them along to our penultimate Carers Lunchtime Information Series to share who they are, what they do, and the services provided, which may be of use to our informal and unpaid carers that we support. So, welcome, and I'll hand the virtual floor over to Katie to start.
Hi, Emma. Thank you very much. Really appreciate that. So, hi, I'm Katie Fowle. I am the Senior Physical Activity and Health Coordinator, and I sit within the Physical Activity and Health team at Derby City Council. And I've come with my colleagues Kelly and Christine today to talk about what we do in the Physical Activity and Health team. So, what I'm going to do is just share my screen so I can have up the slide deck. So, just bear with me 1 second. Now, I might just need someone to put a thumbs up as to whether they can see the screen or not. Thank you. I just know because I'm talking to my reflection. So yes, we are the Physical Activity and Health team, and that contains Cycle Derby, Live Well, and Move More Derby. So what does that actually mean, and what do we do? So the whole purpose of why we exist is so that we can work really closely with our individuals, our streets, our communities and places in Derby. And we really want to focus on improving people's health and well-being with a focus on daily movement levels and really increasing those. But we want to do that in a way that is all around how does it work for those individuals. So we are not here to tell people what to do and how and when. We want to understand what would support and empower them to live really good, well and active lives and explore how we can do that together. So we do collaborate with lots of different groups and organisations. We're really mindful that there are so many fantastic people that work with so many residents in our city, and there are so many great things already happening. So we want to understand that and work with lots of different people towards our aims of helping people to live well and active lives. We also really focus on what positive changes need to happen to support people, and it's not around seeking that understanding from residents and then saying, well, I'm not sure what we can do. It's actually around working together to see what we can both kind of bring to the table to make those small and really practical changes that can enable people to do a little bit more or something a bit differently and just give them really lovely quality of life. So they're the kind of things that we do in the Physical Activity and Health team. How do we do that, you might ask? So we do have some specific community programs that are available, which is why I've brought Kelly and Christine with me today. So they will talk about them in a few minutes. So we've got those really specific areas of support, but we also do focus really heavily on our community discussions and conversations that we have with residents so that we can understand what could be hindering someone from having a really active day, or what could be enabling someone to have a really active day and navigate through their community and provide them with a really good sense of well-being in their community. We also do have different kind of peer support opportunities, and we do have volunteering opportunities as well. So it might be that as a resident, you might want to become a walk leader in one of our communities, for example, or you might wish to become a Move More Derby ambassador, and that's someone who is really passionate about championing physical activity in their local community. As I did mention a bit earlier, it's really important for us to learn about needs of residents and to really strengthen what is already working well in communities. I myself, I'm not from Derby. I don't know what it's like to live and work in the communities that we have in Derby. So it's really important that we're really listening and understanding what is important to our residents and how we can respond to that. We do have a team of physical activity and health coordinators that exist within our communities to have those dialogues with residents and to begin to work on those positive changes and responding to people. And of course, we do have regular attendance at different community spaces and events so that we can share the type of work that we're doing, have more conversations and increase awareness of the physical activity and health team. I just want to share one example, if that's okay, of the type of community conversations and collaborations that we have in our communities, because I appreciate sometimes it can be a bit hard to get a good sense and flavour of what that might feel like. So this is in one community in Alveston, and the conversations we were having with residents was around what kind of activities and opportunities would they like. And they mentioned around walking, but they said the challenge is there's nothing nice to actually look at in our community. And when we dug a bit deeper, just in, general conversation, they were like, well, we want to walk around, but there's nothing nice to look at. And we'd like to actually plant some flowers. So we did a number of things with those residents. The image on the left-hand side with the purple flowers is actually a community planter that was put on one particular street. And the young people that lived on that street came out and put all the bulbs in, and they were really integral to maintaining that community planter and looking after its watering and changing the flowers and everything like that. And that was something that they had asked for themselves as the young people on their street. So that was one kind of part of the conversation that we had. And then the residents were sharing more further afield in their community that actually they'd like even more flowers put in. So we worked with them to identify the plain patches of grass in their community that they felt could really do with a bit of an uplift in terms of bulbs. And the middle picture on the screen is the one you can see with us working with our grounds maintenance team and residents in that community to put the bulbs in the October. And we had a lovely celebration event in the spring when all the bulbs came up in that community. And then the final image on your right hand side, within that community, one resident had a really big front garden. She said, I'm not doing anything with it. And can I convert it into a community garden? And we were like, right, well, let's explore that. And how do we bring that to life? So we worked with lots of different organizations to create her front garden into a community garden where other residents joined her to grow produce and then enjoy the benefits of those produce in the summer. So I just wanted to give you a little flavour of the kind of conversations and discussions that we're having with residents and the positive changes that are happening in communities as a result. So now I'm going to hand over to my colleague Kelly, who is going to talk a bit more specifically about Live Well and what they do within the physical activity and health team. So Kelly, I'm going to hand over to you. If you can just let me know when you'd like me to change the slide, that would be great.
Okay, thanks, Katie. Hello, everybody. My name's Kelly Towns, and I'm the Live Well customer I'm the Live Well customer and marketing coordinator. It's a bit of a mouthful. Next slide, please, Katie. Okay, so some of you might be familiar with Live Well, some of you may not be. We've been around since 2011. We're celebrating 15 years this year. And we're proud to have helped tens of thousands of people in Derby to change their lives for the better. We are the council's healthy lifestyle service for Derby residents. So that includes people who may live outside of Derby, but are still registered to a Derby City GP practice, and those who pay their council tax to Derby City Council. Specifically, we help people to stop smoking tobacco, manage their weight and improve their overall health. We also offer NHS health checks, and I'll explain more about each of those services shortly. Live It is our child weight management programme for children aged 5 to 17 that supports families to be healthier together. Derby County Community Trust runs a programme on our behalf, and they do lots of fun activities such as swimming, games, gym sessions and healthy eating activities. Parents and carers can self-refer for this programme through the Live Well website, and we will share all the contact details for all our services later on. Next slide, please, Katie. Sorry, Katie, next slide, please.
Oh, sorry, Kelly, I'm trying the button. Oh, 1 second. Doesn't want to work for me. Oh, there you go.
Oh, lovely, thank you. So our weight management programme is very popular. We have a waiting list of around 4 months currently. Live Well is quite unique in that we support people to make changes for 12 months. Most other council run weight management programmes in the country are less than that, and more often 12 weeks. What we don't provide as part of our weight management program, and we get asked this a lot, particularly over recent months, we don't provide weight loss medications like Ozempic, Mounjaro, Wegovy as part of our program. Instead, our program is based around healthy eating, regular exercise, and helping people to form healthier habits for life. We do ask that people are ready and committed to making lifestyle changes, and if they're willing, then our team of friendly advisors will give you lots of encouragement to achieve your goals. We have our body mass index criteria listed on the slide. There is an NHS calculator if you search for it to help you work out what your body mass index is. And if you register on our website, it will also allow you to work that out through a calculator on our website too. To get started on our program, we run 10-week new starter groups, which combine healthy eating education with circuit-based beginner exercise. Our advisors tailor the moves so that everybody can join in. They're very inclusive, and the groups are run in different communities across Derby 4 times a year. So we have 4 intakes, and our January courses are just about to start this week. So our next 10-week activation groups will start in April 2026. So following the 10 weeks, we have around 150 to 180 new people join us at each cohort, and then they will move on to attending weekly weigh-in drop-ins, Live Well classes, quarterly review meetings, and they can access a range of wellbeing workshops and exercise sessions, including women's only, gym, and lots of other things like Live Well walks, which are open to everyone, couched 5K, and too many things to mention, to be honest. It really is a jam-packed program, which is probably why it's so popular. We also run, in addition to our weight management program, we also offer 2 specialist weight management programs. One called Livability, which is for people with learning and other disabilities, and we have a really good specialist advisor, Mark, who works with carers and the client to develop a plan of healthy eating and exercise. He's really good, and he runs friendly multi-sports, including bocce, new age curling, seated volleyball. He offers support to enable people to use Derby Arena and Springwood Leisure Centre gyms, to swim at Moorways. And he also does a lot of outdoor activities, including trying Cycle Derby's accessible bikes in Markeaton Park, which I'm sure Christine will mention when she comes on to her bit. Our second specialist weight management program is a perinatal one, so that's for pregnant women and new mums, and that's run by Emma, another of our advisors, and she sort of supports women to safely get back their fitness and be a healthy weight, and they enjoy things like baby yoga, buggy walks, exercise in the park with baby. And in addition to all of that, we have a really good virtual offer. We have a Facebook support group which clients can join, and they can remain in that group after their 12-month program has finished. Next slide, please, Katie. So this is Natalie. Natalie is one of our former clients and is now a volunteer. She joined our service 2 years ago. She's a lovely lady, a single mum with 5 children, and 4 have complex learning disabilities. At the point she joined, she had constant joint pain. She struggled with walking upstairs and even playing with her children. She tried slimming clubs and injections over the years and had bouts of success, but she found that she put on more weight once she stopped those groups and diets. And she came and joined the service really keen to lose weight and get healthier. So during her year on the programme, she lost over 3 stone. She embraced everything that we got on offer. She made changes to hers and her family's eating habits. She's now a huge fan of batch cooking healthy meals, and she demonstrates this in our Facebook group. She found confidence to exercise. This is something that we find a lot with people who are returning or are new to exercise, that sort of gaining that confidence to sort of step through the door and even give it a go is really difficult for a lot of people. But through our Live Well classes, she's that confidence started. She started to use the gym, she built her strength, she improved her mobility, and she increased her fitness. She now exercises, she loves exercising regularly, and she has no joint pain. This has had an amazingly positive impact on her family. Her children are happy because she's happy. She can run around with them and keep up with them. And since she's finished on the programme, she's a volunteer with the service, and she shares her experiences and tips at our new starter groups, classes, and in our Facebook group. So next slide, please, Katie. Sorry, bear with me. So our Stop Smoking programme aims to stop people to stop smoking tobacco. So I just want to be clear on that, for good. And we welcome back people who have used our service before and maybe have relapsed. We come from the angle that quitting is a learning process, and each attempt is seen as progress. People can register on our website and book a phone appointment to get started. Our friendly advisors provide support to help people to set a quit date and then plan their quit attempt. They'll discuss with them the best treatments to manage withdrawal symptoms, which Live Well provides for free, and that saves on average around £200. We offer a range of nicotine products, so that's vapes, patches, gum, lozenges, and mouth spray. For those of you who might not be aware, nicotine is the addictive part of smoking, but it's the tar and other components in cigarette smoke that cause the harm. So we allow for a gradual reduction of nicotine intake over the 10 to 12 weeks to help the brain adjust to lower levels and eventually become dependent of it. We also offer stop smoking medication, which is available by prescriptions issued by our team. We offer varenicline, which some people might know as the old brand name Champix, and we also offer cytosine. And these medications work by stimulating the same receptors in the brain that nicotine does, and then by blocking the reward effects of nicotine. So the normal release of dopamine isn't achieved, making smoking less enjoyable and much less rewarding. We run stop smoking drop-in clinics across the city for clients who have had their initial appointment to collect their products, have a carbon monoxide test, which helps people tangibly see the results. So when people see their carbon monoxide level reduced to that of a safe level and that of a non-smoker, that quite often motivates them to stay quit. And they can also get extra support from our team at these stop smoking drop-ins. Next slide, please, Katie. So this is Mark. He joined our service in his 40s. He's a taxi controller, and he smoked 60 a day and spent quite a lot of money on smoking. At the point he joined us, he was out of breath. He slept excessively, he was barely moving, and carried a lot of excess weight, which he put a lot of that weight on during the pandemic. He used nicotine products to quit, and said his advisor checking in with him regularly helped him to stay motivated and to stay quit. And once he quit, he wanted to shed his excess weight. He joined his local gym. So he didn't actually join our weight management program, but he joined his local gym, which served as a really positive distraction to his smoking. He lost 4 stone that same year, and he used the money he saved to retrain as a barber. And this was his dream vocation, and something he wouldn't have had the physical stamina to do if he hadn't quit smoking and improve his health. So yeah, really positive for Mark. Next slide, please, Katie. So I mentioned before that we also offer NHS health checks. NHS health checks are a free checkup available to people aged 40 to 74 in Derby, offered every 5 years to detect early signs of serious conditions like heart disease, stroke, type 2 diabetes and kidney disease. The check is available to people registered to a Derby doctors aged 40 to 74 who aren't already diagnosed with heart disease, high blood pressure, high cholesterol, kidney disease or diabetes. And the reason for that is that people diagnosed with these conditions should already be being monitored. So the check is designed to pick up people who may have high blood pressure or high cholesterol and not know it. So checks are available at most GP practices, but Livewell offers them for some practices in Derby who have opted out. And this includes Park Farm in Alistree, Chellaston and Melbourne Medical Practice and Overdale Medical Practice. However, anybody who's eligible can book an appointment with Livewell. So our 45-minute check includes body mass index, blood pressure, cholesterol, diabetes risk, family history, lifestyle questions, and all the results are given during the 45-minute appointment. The results also combine to give people their heart age, which is really interesting for people to be able to see how that compares to their real age, and a risk score of having cardiovascular disease. Following the check, our health check advisors discuss ways that people can maintain or make changes to improve their cardiovascular health. The results are shared with the person's GP practice, and further investigations are actioned by the surgery if needed. So it's a really good way for people who may be at the early stages of cardiovascular disease to find out so that they can prevent serious illness. Some people might ask why it's capped at 74. And it is capped at that age because patients age 75 or over can request an annual check with their GP. And included in the check is signposting to other services should they be needed, including Livewells for people who may want to manage their weight or stop smoking. So that's the end of my part of the presentation. So I'll ask for the next slide.
That's me. Hello, everyone. My name's Christine Kelly. I work with Cycle Derby, part of the City Council. Half of my role is about coordinating the delivery of bikeability into the schools around the city. People might be more familiar with bike proficiency as the term. That's getting children riding bikes, riding confidently and competently in the presence of others, first of all in a traffic-free environment, and then moving out onto local roads in readiness for them potentially making a journey to secondary school. So we target quite a lot of our activity in schools to years 4, 5 and 6, so 9, 10 and 11-year-olds. The other half of my role is to look after the inclusive fleet of bikes that my colleague has just referenced. Based over at Mark Eaton Park, we have an extensive fleet of bikes to suit riders of all capabilities. That includes standard 2-wheel bikes, electric bikes, and then a range of 2, 3 and 4-wheel bikes, some of which are for single riders, some of which take tandem bikes in reality, with a pilot and a stoker. We are a small team in the city servicing the residents and the schools. We can share bikeability offers that you can't access, or your family can't access from within the school, outside of the school as well. And we support adults who come looking to us for assistance in either learning or getting back onto using a bike recreationally, if they are following up on rehabilitation or injury, or actually if they just want to build confidence back to be able to use the cycle as a main use of transport. So our trainers, who we've got about 20 plus trainers, a mixture of casual and contract staff, can host sessions with individuals by prior arrangement, either at our Markeaton Park site or at a home address if that's suitable. And that might just be to, you know, build confidence back on starting a journey on the road, or if you've not got access to a bike, then using the facilities that we've got extensively at Markeaton Park. If you move on to the next slide, please, Katie. There's a lovely picture of a young man that came to us a couple of years ago as part of a group, and this is really just to serve illustration of how you can access our services. So initially, lots of the riders that we host will come with a group within a group. Live Well come to us regularly in the summer, but we also host care groups and focus groups. For example, Parkinson's Derby will come to us regularly, bringing a selection of their members just to experience the different bikes around the traffic-free areas of Markeaton Park. It's a lovely park to come and enjoy riding your bike on. This yellow bike in the picture is a three-wheeled tricycle. It has a nice seat rather than a saddle for riders to sit on. A single gear, but all of those features, there are options on the range of other bikes in the Aladdin's Cave that we have at Markeaton. So a bike for everyone. If you find a bike that's suitable for you and you want to come back regularly, then we host individual sessions on a Thursday afternoon throughout the year. And when it gets busier in the summer, there'll be another day or two in the week where that service is open for individuals rather than group bookings to come. We host a number of schools in the park as well on different afternoons of the week, where they will bring 6 to 10 riders of varying abilities with physical and learning disabilities to have a go, to ride with their peers in the park. So yeah, a route through for individuals or groups learning or building skills on riding. And we've got a bike for everyone from very early ages. So we've got a full learn to ride fleet with services that can be accessed in the holiday periods for riders who haven't yet learned to ride, all the way up to 105-year-olds that we've got at the moment that come regularly, come each week with a group of stroke victims to ride together, a little bit of companionship and a little bit of recreation and a bit of catching up. So a bike for everyone. Sometimes there's a small charge to access our bikes, and sometimes they are. I certainly know that Mark at Live Well has funded sessions with us to get people to come and have a go. So definitely talk to us to see whether or not we can access funding for you to come and experience the bikes. I think I've covered all the things that I wanted to cover. I'll close it there. I'll check there's no other slide, Katie, that comes next. I think that's just the closing one. Yes.
Just the closing one. Thank you, Christine. Yeah, so just to say, everyone, thank you so much for having us today. And we have put all of our website links and our email addresses and our telephone number if anyone does want to get in touch to talk about any of the content that we've talked about today. But otherwise, thank you all very much for sharing your time with us today.
Thank you, Katie, and all of you for that information and those inspiring stories as well to really support kind of motivation to access your services. So I know I'm just looking at the chat. So there is a question around what would be the advantage of accessing a health check with LiveWell over their GP if they're not one of the surgeries that don't do them. So I think, Kelly, are you able to answer that one for us?
Yes, of course. That's a very good question. I think it's the time that we can allow each person. If you have a check with your GP practice, they're quite often 15 minutes, which covers all the same tests. But quite often you'll have to go into the surgery separately to have your bloods taken, and then you'll have a 15-minute follow-up appointment to discuss the results. Because our appointments are 45 minutes, it gives our advisors extra time to discuss results in more detail. And quite often people are unfamiliar with what blood pressure numbers mean, what cholesterol levels mean, and what actually is cholesterol in the first place. So our advisors have the time to explain that and explain the results with more clarity. And another benefit is that the blood results, the blood is taken through a fingertip test, and those results are given during that same appointment. So there's just one visit.
That's really useful to know. Thank you. And I'm just also wondering, kind of, what's that length of time from when referrals go into initial contact and then kind of being able to be offered a place and engaging in a scheme?
Is that a LiveWell specific
Well, I think
question?
both, actually. Yeah. Over to both of you. Yeah.
Okay. If I'll go through the LiveWell programs first, if that's okay. So the weight management program is around 4 months, and that's because we have 4 intakes a year of new people starting on a quarterly basis, and then we have another month wait on top of that currently. So that's around 4 months. However, for stop smoking, we can normally get people can normally book their own appointment online in the same week. And we can get people in for an appointment the same week, sometimes even the same day. And that's the same for NHS health checks as well. We've currently got appointments that in the same week.
Great, thank you. And Christine, how about the cycle derby?
Again, it's a little bit of how long is a piece of string. So I've had occupational therapists emails in today asking for rider appointments for a rider who's had a stroke and has got impaired vision. So in reality, we could host that rider this Thursday, weather dependent, of course. We've had a little bit of disruption most recently. And it all depends really when they're available. So we're currently, with it being winter months, it's a little bit weather dependent, and riders have to be happy to sort of come when it's not particularly warm. So we try to make available every other week a weekend slot as well as the day in the week slot. And then it'll be which bike is the preferred bike they think they want to come along and access. So we have there's a couple of very popular models of bikes that get booked out quite regularly. So again, it's just finding the right fit and finding time where they can access potentially the whole fleet. So the first visit, where it's exploring the fleet of bikes to understand what they want to access, what suits their own circumstances. So generally, I would say that within 2 to 4 weeks, we can have offered an appointment. Whether or not that's suitable to the client is then the how long is a piece of string question.
Thank you. Thanks, Christine. So are there any other questions that can come through the chat? We'll just take a minute to see if anything arrives. We've got someone who shared from their own personal perspective, actually, the success of the schemes, the LiveWell scheme. So it's always good to get that kind of personal, anecdotal experience, isn't it? So Okay, I think that's it. So thank you so much for your time. We'll put this recording up on our resource library with the contact information in the links below the recording. And I'm sure this will be really useful to the carers that access our service. So thank you very much.
Thank you,
Thank
Emma.
you.
Lovely to see you all.
Thank you.
Bye.
Take care. Bye.
Stop the
Thank you.
recording.
Thank you.
Bye. Thank you.